After we work on the framework and structure of the skin and anti-aging from a bioregenerative filler perspective, we also look at outside factors that can worsen our collagen production or break it down over time. These things can be sun damage, vascular irregularities, our age, oxidative stress, also muscle movement. And muscle movement is something that over time breaks down our skin, essentially creating a scar or a deficit in the collagen and elastin production, which gives us those lasting rhytids or static lines, as we usually call them. It can also create our dynamic lines where when we move and when we express ourselves and emote, we have crow's feet and things like that. Everybody is different as far as what lines concern them. Typically what we see is, our frown lines, our 11s, as most people call them, and other lines or, laxity that make us look sad or grumpy. Using neuromodulators like Botox, Xeomin, Dysport, we are able to decrease that movement over time. But it's important to remember that the goal is never to decrease our expression. Our expression is our identity. We want you to still look like yourself. We don't want to just freeze all muscle movement so that we're able to produce more collagen and those lines disappear for forever. Neuromodulators typically last us about 3 months, but that 3-month mark, we expect to see more movement at that point. So it's kind of a bell curve where we inject a neuromodulator, we have about 2 weeks for a 2-week peak, and then that 14-day mark is where we have a peak hold of the muscle movement in the face. While we have our neurotoxins active, where our muscles are not able to damage the overlying tissue over and over, that is a great time to optimize your collagenesis and elastin production. So lots of people will layer treatments with their neurotoxins along with microneedling, with PDGF and other topicals, as well as fractional laser treatments to help collagen neogenesis. Because we view expression as identity, our neuromodulators are dosed based on your muscle strength and how severe your current lines are that we're treating. Everybody's dose is different. We don't base it on age, but dose does equal duration. So the stronger the muscle or deeper the line, you can expect a higher dose of neuromodulators. That doesn't mean you're going to look frozen necessarily, and that's never the goal. We want you to look rested and like yourself. The best neuromodulator injections, the best filler injections, are undetectable. Most people, when they think about injectable treatments, our mind completely goes to the crazy faces that we've seen, overfilled faces, lots of pillowy puffiness with fillers, or eyebrows in the hairline or a completely frozen face. This is never the goal at Refine. We like a very restrained approach and find that this gives us the absolute best results so that those that love us and our peers recognize us based on our expressive abilities without looking too done. Truthfully, we all see really good aesthetic work every day. We just don't know we're seeing it because it's undetectable.